What will follow is defecating proctogram. The purpose of this still X-ray is to identify the different anatomical structures which you will be seeing in the video sequence. R is the rectum. It has had radio-opaque dye injected into it. The red square identifies the anorectal angle. To the right, you will see the levator plate muscle. It has had 10 mils of radio-opaque dye injected into it. On the superior surface is a white line which is almost horizontal, and that identifies the superior surface of the levator plate. Just below, you will see a yellow circle. This has been placed around a space in the levator plate. This space will be seen to move according to the particular muscle contraction. In squeezing, it will move upwards and forwards. In straining and defecation, it will move backwards and downwards. During squeezing, all the structures are pulled upwards and forwards. Note how incredibly elastic the structures are and how much they move. So the rectum and the anorectal angle is made more acute, and the levator plate itself is lifted forward. This is probably due to the contraction of the puborectalis, which lies underneath the levator plate. This next segment is the description of straining. The patient has fecal incontinence, and you will see that the sequence opens with a very tentative attempt to strain. Finally, the patient strains. The tip of the levator plate is pulled downwards, and you can see that there is some feces exiting from the anus. In defecation, the muscle movements are similar to what is seen in straining. That is, that the anterior border of the levator plate is pulled down. But in this case, you will see that there is an opening out of the anorectal angle due to relaxation of the puborectalis. Also notice how the anterior surface of the anus is pulled forwards to open out the lower end of the canal. So we see that the upper end of the canal is pulled open by relaxation of the puborectalis, and the lower end of the canal, the anterior surface of the anus, is pulled forwards by the forward contraction of the pubococcygeus muscle.